Hello everyone, my name is Dr. Aubry and I'm a chiropractor practicing in South Burlington, Vermont. I specialize in brain-based therapy, and today I want to talk to you about a condition called fibromyalgia. If you or somebody you love is suffering from fibromyalgia, that's why you're going to need to want to listen to this talk today about fibromyalgia. You can beat fibromyalgia. Now, I've had patients come in here and say, Dr. Tager, I figure that if you can help people with chronic pain and peripheral neuropathy, you can help me. I suffer from fibromyalgia, so please, what can you do to help me? Well, I do work with chronic pain patients. Those are people that are suffering from long-term types of problems that no other kind of relief has helped them. They haven't been able to get any kind of relief from their family doctor or from a chiropractor or from a surgeon or any kind of medication that's out there. Now, I want to start out by prefacing something. I do not treat or cure diseases. Many, if not all, fibromyalgia patients suffer with thyroid disorders. I do not treat or cure thyroid disorders. I do not treat fibromyalgia. Now, what I do is I increase the immune system. When we're doing that, when we increase the body's immune system, what that does is that helps to decrease inflammation, and it helps to detoxify the body. Some people will say, well, I went to a chiropractor and I was worse after I went. Well, we do things a little bit differently here in this clinic. You can go to a website called www.lifechangingcare.com, and that's going to give you a little bit more of an insight into the types of things that we do here at Get Healthy Vermont. Now, currently there's 253 fibromyalgia patient testimonials on that website. You can also go to www.askdrjohnson.com to get some more insight into the types of therapies that go on here, as well as visiting our own website at www.gethealthyvermont.com. So what do we do here? Well, we're complete natural protocols to detoxify and improve your immune system. That's what we're trying to do here, to improve your immune function. So what are we going to look at? We're going to look at structural things, we're going to look at chemical, we're going to look at even your emotional problems or things that are interfering with your body's EMFs or electromagnetic forces. We know that there's that all around us, and with the increasing usage of cell phones and other kinds of problems that emit their own magnetic fields, that causes a lot of different problems with health as well. And we're also going to look at specific organs, whether it be your liver, your gallbladder, stomach, or pancreas, and how those might affect your health as well. So what type of testing do we do here? Well, we're going to look at blood work. We're going to look at things like liver enzymes. Are they high? Do you have any kind of thyroid issues? Is there a decreased gut function? Do you have high uric acid? We're going to look at things like a Cyrex test. Cyrex is very important because what that does is it allows us to get a better view into the types of foods that you might be sensitive to or that you might have an allergy to. And if somebody is having an allergy to a product like gluten or soy or yeast or dairy, then that's going to cause an increase in inflammation in the autoimmune system, but not just an increase in inflammation there, you're also going to get an increase in inflammation on your brain as well. So another test that we do is what's called an organic acid test. And what this does is it's actually going to look at the different pathways in your body, like the Krebs cycle. You might have heard that back in high school from when you take science or biology. The Krebs cycle is basically how your body is processing certain foods, carbohydrates and proteins, and whether or not there are deficiencies there. And this test called an organic acid test is going to show us that. Now, one of the most important things with any kind of autoimmune problem or any kind of chronic pain is the gut function. Now, we know that if somebody is having a problem in their gut, if they take certain products, and we have some fantastic products from a company called PRL, so some of the products like Gastrovan or HCl, which is hydrochloric acid, or HCl activator, these are going to help your gut function. And we're going to get to that, why gut function is so important, a little bit later on in the talk. Now, some other things that we talk about are organic vegetable juicing. You don't want to do too many juices like goitrogenic juices such as cabbage and Brussels sprouts, but you want to stick to some specific types of juicing, and also looking at different things like infusion drinks, and those are some other products that we will look at, like Max ND and Inflamma ND. These are all just proprietary names for some of the products that are really going to be beneficial to helping people's immune systems from that company PRL that I had mentioned earlier before. Now, the vast majority of fibromyalgia patients suffer from autoimmune conditions. What does that mean? Now, why is it important if you have an autoimmune condition? Well, what that means is it means that your immune system is attacking your own body. How do you stop your own immune system from attacking your body? Well, the first thing you have to do is you have to decrease inflammation. And if you decrease inflammation, you're going to detoxify the body and build up the immune system. One of the most important things to understand is that there are actually two parts to your immune system. You have what's called Th1 and Th2. You need to increase the function of your immune system based on your type. If you are Th1 positive or Th1 dominant, then you have to focus on what's best for you. Same thing with Th2. So Th1, what we look at is it's kind of the Pac-Man of the body. Th2 is more of the antibodies that remember the bad guys that are there. So Th1 and Th2 have to be in balance. If you're taking products that are more Th1 dominant and you're Th2 dominant, that's not going to benefit you in any way. So when we look at Th1 support, some of the products or some of the supplements that we look at are going to be vitamin A, vitamin C, zinc, echinacea, licorice, lemon balm, maitake mushroom, or garlic. So if somebody tells you that they're having problems, or let's say they're suffering from an autoimmune condition, or they're suffering from some form of cancer, and they read in a book that they should take maitake mushrooms and that's going to help them. Well, it might be the case if they were Th1 dominant, but if they're Th2 dominant, that's not going to help them, and it might actually make them worse. So when we look at Th2 support, we're looking at things like pine bark extract, we're looking at green tea, grapeseed extract, resveratrol, which is present in wine, and that's why we tell people, you know, it's good to have a glass of red wine a day, but it's also found in grapes, so you don't really need the alcohol content, but it's also important to know, once again, if you're Th1 or Th2 dominant. Some of the other things we look at are lycopene and caffeine. These are going to benefit people that are Th2 dominant. So 80% of your immune system is found in your gut. I bet you most people did not know that. One of the biggest problems that I see with fibromyalgia patients is hypochlorhydria. So what that is, we just talked about this a little earlier on, and I said I would address it later. Hypochlorhydria is decreased stomach acid, or HCl. Now HCl allows for a better flow of your lymphatic system, and it helps to create methyl groups. How do we test for this? Blood work. So the first thing we're going to do is we're going to look at total protein, we're going to look at serum globulin, BUN, and phosphorus. Then we can also do some applied or clinical kinesiology tests. We want to make sure also that we're not taking things like alkaline water, because that can make things worse as well. The internet confuses me, some people say. One person tells you one thing, another one tells you something else, and you don't know what to do. How are you supposed to know what's going to get you better? How are you going to know? Lab testing. Lab testing is important. Kinesiology testing. So what do we do differently? This is what this whole talk is about. How we do things differently and how it could possibly benefit you in your condition that you're suffering from right now, fibromyalgia. So a little bit about myself. My name is Dr. Aubry Taker once again. I'm a board eligible chiropractic neurologist. I'm a chiropractor and I've been in practice since 1999. I'm in private practice here in South Burlington, Vermont, and I work with a doctor named Dr. Michael Johnson. He's the author of the book, What Do You Do When Medications Don't Work? It's a non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I've been working with him for about a year now, and we have a group of over 800 doctors in the US that treat patients both neurologically and metabolically. Why is that important? Well, because we want to support the body and allow for maximum healing. It's all about achieving maximum healing by increasing the body's immune system. So my goal is to help you find the most effective way so that you can enhance your body's immune system. Now, when you start to have problems with thyroid battles, and you want to have the best chance of possibly living long and a healthy life, this is what you have to do. You've got to address the things to get your body so that it can heal at its maximum ability. Now, who are you going to be discussing fibromyalgia with? Who's going to be the authority on this? Well, if you happen to suffer from problems like Hashimoto's or thyroid disorders, you want to make sure that you've been to somebody that has experience in dealing with these things. Now, Dr. Johnson himself actually wrote the book on fibromyalgia and thyroid disorders, so it's a pretty good authority, and when you have somebody like me who's able to work with him and give you this information, pass it on to you in your local area, that's a pretty safe bet that you're going to get some pretty good information that you haven't been exposed to in the past, and this is definitely going to be something that can help you. Now, one of the most important things with this is it's not like taking medication where you can possibly have side effects. There's no side effects to helping yourself out. There's no side effects to eating properly. There's no side effects to getting the proper therapy that you need in order to allow your immune system to function at 100%. So every fibromyalgia patient has an issue with their thyroid. This isn't just a fly-by-night thing. It's not just one person out of 1,000. Every single person that has fibromyalgia has some form of issue with their thyroid. Let's talk a little bit about the thyroid gland. The thyroid runs our metabolism. It's basically the gas pedal of the body. Every cell in your body has a receptor site for thyroid hormones. A lot of people don't know that. I'll say that again. Every cell in your body has a receptor site for thyroid hormones. Now, the hypothalamus, you have TRH and the pituitary and thyroid and iodine. Now we're going to look at all of these different types of products that are being released from your thyroid and how they affect your body. In the liver, we have 60% of the conversion of what's called T4 to T3. In the stomach, we get 20% of it. And in the rest of the body, or in the periphery, we have 20%. Now, some people say, I've had my thyroid removed, or I have thyroid cancer. Well, I'm here to tell you that there is new hope. One of the things that you can do if you want to learn more about thyroid conditions, above and beyond how it affects people with fibromyalgia, you can actually go to foxvalleyrelief.com, and that'll give you a little bit more about thyroid conditions and how the types of treatments that are available right now here at Get Healthy Vermont can help you. So, this presentation is going to be covering medical approaches, alternative approaches, my approach, specific testing, and how I can help you. Some simple things that you can do to help yourself. What's the medical approach for people with fibromyalgia? Well, a lot of medical doctors will blow off fibromyalgia patients. Fibro patients are what they call whacked. Now, MDs think that fibromyalgia patients are crazy, that it's all in their head, that they have to learn how to live with it. It's not that bad, they tell them. Just go out and exercise and it'll go away on its own. Well, there's an alternative approach. My approach. My approach is an integrative approach. Now, what does that mean, an integrative approach? Well, what is the best approach for an individual patient, and how can we bring things together in order to get the patient better? How do I know what to do? Well, based on lab tests and based on additional testing, that's how we come to the determination as to what is best for each patient. Fibromyalgia is a chronic illness. Your body has been sick for a long time, for months, maybe even years. And now you have a label stuck on you. So what you have is what they call a web of physiological dysfunction. Along with fibromyalgia, you also have other kind of health factors. Gut dysfunction, like we talked about, blood sugar dysregulation, inflammation, autoimmune problems, possible brain and neurotransmitter dysfunctions, and some people even have anemia. On top of that, you compound it with liver and gallbladder dysfunctions, fatty acid dysregulation, carbohydrate dysregulation, toxicity issues, potential toxicity due to dental work, amalgam fillings, and mercury poisoning. All of these things need to be functioning optimally for you to achieve maximum healing. So we've got to make sure that every single corner is looked at, that we make sure that we cover all the bases. Now, you might say, I've had lab testing before, and all my labs are normal. Well, lab ranges are very broad. Let's look at blood work. CMP, or just a basic blood panel, what we're looking at is we're checking blood glucose. We're looking at the liver, the kidneys, iron levels, vitamin D, homocysteine, glycosylated hemoglobin, CBC with auto differential, and thyroid panels, TSH, FT3, FT4. These are all different compounds that we're going to be looking for. These are all things that we're going to look at as far as functional ranges as opposed to pathological ranges, which we'll get into in a couple of minutes. So we'll look at a lipid panel as well, cholesterol, HDL, LDL, and triglycerides. Now the other thing we're going to do is sensitivity or reactivity testing, or how your body reacts to certain kinds of foods. So with Cyrex Labs, what we're looking at is a test called Array2. Array2 is going to look at your gut function. How is the degradation of the epithelial lining going on in your? Do you have problems doing? Is there degradation going on in your body? We have to look at to make sure that there are things called tight junctions that are staying together, because as those tight junctions are failing, that allows for more problems to occur in your gut. Now, Array3 is going to look at gluten reactivity. Are you sensitive to gluten? Are you sensitive to wheat germ? And then we're going to look at Array4. Array4 is going to look at cross-reactive tests. So corn, rice, potatoes, coffee, other grains, dairy, soy, eggs, chicken. All of these types of foods might have an influence on how you're feeling, and it might be causing you more pain and more inflammation. Then we look at Array5. Array5 deals with autoimmunity. Last but not least, we're going to have the organic acid test that I talked about earlier on. This is a test that's done by urine through a company called Metametrics. And basically what it's going to do is it's going to show us how your fatty acid metabolism is happening, as well as carbohydrates and energy production markers. So how you're actually breaking down the food, and if you're missing certain parts of those, if there are certain compounds that are missing, certain vitamins and minerals that are needed in order to break food down, is that happening, and where is it happening, and how can we address that? So we want to look at neurotransmitter markers and detoxification markers. Now we can also look at an ASI test. An ASI test is a test to check your adrenal glands. This is a saliva test. Quick cotton swab, very easy, painless. And the reason why this is important is because a lot of people have a lot of stress with their adrenal glands. Your adrenal glands sit right above your kidneys, and they are your stress glands. If you have a chronic condition and your body has been under physical stress, this is a very, very important test. We also have the ability to look at things like hormone panels for both male and female, if need be. So, nutritional supplements may contain things called excipients. What does that mean? What are excipients? Excipients are binders, they're fillers. Why can't I just go and buy a bunch of vitamins at Costco? Isn't that going to give me the same thing that I would get in my doctor's office? Well, no, because a lot of these are filled with excipients. You can buy whatever you want, but it's a matter of what you want to put into your body. So if you want to put into your body things that have fillers or glues that are typically non-nutritive substances, these substances may in fact be toxic as well, then go ahead. But I just want to tell you what's in some of these products. This is an informative thing. This is so that you are informed of what's going on with your body, and then you can make an informed decision as to how you want to proceed, and if in fact you want to continue and learn more about how we can help you here at Get Healthy Vermont. So, would you consume anything that is non-nutritive? Well, we believe it's unnecessary to take nutritional products that have questionable, potentially toxic, non-nutritive excipients and give those to patients. The one thing that I have to preface is that tablets always contain excipients. It's one thing to know. So if you're going to take a vitamin and you're happy with a company, see if they have a liquid substance or if they have another option where you can have a caplet with an actual powder inside that you can either absorb or that you can break it open and put it in some juice. Because anytime that you have a tablet, that's how they're made. They're made with excipients in order to hold them together and bind them together. It's impossible for a tablet to hold together without an excipient. So you want to make sure that you avoid any kind of tablets when you're taking vitamin and supplements. Just a few examples of questionable excipients that are commonly found in nutritional supplements. Go ahead and bring out a bottle, take them out, look at them, look at the back and see exactly what's there. You'll see things like magnesium stearate, which is a cheap lubricating agent. Research shows this to be immune compromising. Methylparaben. Methylparaben is a benzoate family member, and it's a known carcinogen or a cancer-causing agent. Microcrystalline cellulose, which is a cheap filler. Silicon dioxide, also a cheap filler. It's sand, common sand. Natural flavors. MSG, monosodium glutamate, methacrylic copolymers, which is a component of methacrylic acid, and it's been reported to act as reported to have also toxic types of responses in embryo cultures. So triethyl citrate is another product that's a plasticizer. It actually makes things into plastic. Titanium dioxide, cornstarch, talcum powder, which is a common excipient. So all of these things, go ahead and break out your vitamins and your foods and take a look if any of these products are in there. If they are, then you want to make the informed decision that you don't want to put these things in your body. So what we do here is I specifically use individually tailored natural protocols to allow the body to achieve its maximum healing. Now it has to be individual tailored because no two fibromyalgia patients are alike. This is how we're going to help you to heal. Our goal is to decrease inflammation, detoxify your body, and increase the function of your immune system. Our goal is to help you find the most effective natural protocols to enhance your body's immune system so that you have the best chance of having a possible long and happy life. How do we do it? Well, we're going to decrease inflammation, we're going to detoxify and improve your body's immune system, and one of the ways that we're going to do that after we go through the detoxification is we're going to use specific therapies like exercise with oxygen therapy. We're going to use nutrition and natural protocols. We're going to use neurological testing and support. And of course, some of the most important things are hope, empowerment, control, and giving you options. The main thing here is to survive and thrive. Not just survive, survive and thrive. I want to help you live. Now a little bit about insurance. Insurance doesn't always cover this types of care. They might cover some of it, and if you do have insurance, we will work with you on that. Whatever the insurance pays, fine. Whatever they don't, we will work out a plan in order for you to get the best possible care that you need. What's the value to you? Does this make sense? Does what you're hearing here today make sense? We're here to get people better that cannot and have not been able to get better anywhere else. People come to us as a last hope. When you're ready for this type of commitment, we're here for you. So if this isn't the time, that's fine. Give us a call back. You're always welcome here. And you can always go to our website and look at more information. We will do everything in our power to work with our patients. We'll work with you with your finances, because the most important thing is information without action is not going to help you. Now, a consultation, just to see if there is anything that I can do to help you, and if we're on the right track, is normally $100 in our office. So, empower yourself to take responsibility. This is responsibility for your health. What is the value to you? Does this make sense? Set an appointment for a consultation. Come in and talk to me about it. Because, like I said, information without action is not going to help you. A diagnosis of fibromyalgia is not a death sentence. It does not mean that you have no chance of living a long and happy life. You do. What can you do now? How can you help? Well, some tips that I'm going to give you. Change your diet. No refined sugar. And that includes things like soda, red meat, caffeine. Eliminate things like alcohol, white flour, fruit juices, highly saturated fats, and all food additives. Get rid of the junk food. If you smoke, stop now. You want to increase the amount of fresh organic vegetables in your diet. Now, you want to be very limited on the amounts of fruits that you eat. Stone fruits, eat them once a week. You want to have organic or grass-fed chicken and fish, and be very limited in any red meat. The next thing is we want to deal with detoxification. So, we want to do things like go in a steam room, drink distilled water, get out in the sun. Vitamin D is very important, and you need that from the sun. Use coconut oil. If you're cooking, get away from the things like vegetable oil and use coconut oil. Stop eating gluten. Get rid of dairy and soy. Some final thoughts. Ask yourself the following questions. How has fibromyalgia affected your relationships, your finances, your family, and other activities? What does it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 2 or even 5 years if this problem is not taken care of? And what's it worth to you? If you can improve this condition, what is it worth to you? So, if you're interested in setting up an appointment, call our office. The number is area code 802-230-4678. And if you're really interested in this program, I'm going to cut the cost down to $49 from the regular $100 if you call because you watched this video on our website. So once again, my name is Dr. Aubry Tager, and come see us at Get Healthy Vermont, and I thank you and have a great day.